Welcome to EPG Pathshala. My name is N. Purendra Prasad. I am working as professor in the Department of Sociology, University of Hyderabad. Today I will be talking about Module 6, Social, Economic and Political Determinants of Health. This is part of Sociology of Health course. Health actually is determined by the social, political and economic factors. In fact, there is a direct correlation between poverty and ill health. Why is that so? If you look at the third world countries, a large part of the poor people are affected with a large number of diseases. There is a higher proportion of health risk. So, what does that mean? Poverty actually causes ill health. Ill health, in fact, increases the burden of poverty. So, it's a vicious cycle. Both actually feed into each other. So, is it that the poor people actually get affected with ill health because of their superstition, because of non-compliance to medical treatment, because of their unhygienic practices? No, it's not. If you look at the way the society actually is providing access to the resources, particularly the health services, it is always provided for the affordable groups, and also what causes actually ill health is in terms of their housing, their sanitation, drainage, lack of safe drinking water. Several factors actually play a very important role in terms of causing ill health. In India, the major factors that contribute to the mortality rate, particularly two diseases actually contribute to high mortality and morbidity rates. One is malaria, second one is tuberculosis. And both of these tropical diseases have been there for decades. Our status actually in terms of improving the situation in health has not changed for decades. So there is a kind of a direct kind of a link between the conditions of poverty and that of ill health. So if you look at our neighboring countries, for instance, if you look at Sri Lanka, their health status actually is much higher compared to India. Now, if you compare it with some countries like Cuba, which of course is a different kind of a social system, which is based on socialist economy. Okay, so where there is collective kind of responsibility, state actually takes the entire responsibility to provide free education and free health. So, and therefore Cuba has higher health status. But what about Sri Lanka? Sri Lanka is not a socialist state. It's also one of the small island country which is like us, a kind of a capitalist economy. The way Sri Lankan healthcare system works with a large support base from the state. So it is about in terms of what kind of priority, how it is actually strategized, etc. So in trying to actually explain the social, political and economic determinants of health, Sheila Zubri has written a book called Raku's Story. Raku is a agricultural laboring woman from one of the South Indian villages in Tamil Nadu. And this whole book is about how an agricultural laboring population actually suffer from ill health, and what kind of livelihood options or what kind of medical services they have, how they are able to negotiate, etc. To be very brief about Raku's story, Raku actually, this major event is about saving her 11-month-old child who was actually suffering from diarrhea. And she makes heroic efforts to actually save this child through various mechanisms. She tries through the local kind of medicine that's available in the shop. She tries through the temple rituals, home remedies, herbal kind of a medicine provided by the local healer. Then she also tries the modern medicine, injection medicine from the nearby hospital. With all these efforts, she was not able to save her 11-month-old kid. In fact, her description of going to an urban town for healthcare access itself is a long story. In the late night, where transport facilities are actually very minimal, Raku actually had to go along with the child to a nearby town. The husband, who is also busy with agricultural harvesting and other activity, was not able to actually accompany or take the child. A woman actually going from a village to an urban center and negotiating with the medical services and negotiating with the doctors and paramedical staff who actually do not provide accessibility to the poor women is itself a long story that is written in this book. The point that we are trying to make here is that, despite a lot of effort to reach out to modern medicine, the children actually are dying, women actually are suffering from anemia, a lot of poor people actually are suffering from the disease burden. Okay, this is largely a factor not simply in terms of medical professionals alone. Here, it's no point in trying to say that it is the problem with the medical doctors. No, medical profession has certain role in terms of the institutional kind of provisioning, where they are supposed to actually provide treatment, especially in the primary healthcare center, community healthcare center, and the district hospitals where it is provided free of cost. But that's not the point. There are a lot of factors which go beyond medical profession. The way the economic factors, the political factors, and the social factors impinge on the health status actually is something that we need to understand. If you look at economic conditions, okay, the 90% of the people who actually do not have land, or even if they have, they are all small and marginal peasants dependent on the land owning classes. Okay, and when you look at the these laboring kind of poor people, okay, who are actually conditioned by the resource availability, because of their low income, because of their lack of employment opportunities in the rural areas and even in urban areas, so their lower educational skills, all this is actually interlinked to their class position. Vincent Navarro, actually one of the health kind of an economist and social scientist, actually talks about how class plays a very important role in restructuring the the institutions and institutional delivery mechanisms. Okay, so if health resources are available only to a small proportion of the people, if huge advancements in medicine and medical profession are not available to the large masses, the reason is that it is the class interest of the particular society which is actually trying to siphon off the resources and structure the institutional kind of facilities for their benefit. So when you look at the economic structure, I think it becomes very clear that the poor people and the laboring or working class people actually have a greater difficulty in reaching out and accessing the healthcare services. And today, of course, state is providing certain kind of welfare benefits to Rajiv Arogyasri and other kind of programs. But even then, the way Rajiv Arogyasri works only for the benefit of certain surgeries and certain procedures, not for all diseases that it's available. So the affordability becomes a very important factor, and therefore I think economic factors actually need to be taken into account. Then when you look at the social factors, the caste, religion, the patronage system, the way, the entire kind of social organization where the norms, values, taboos in each society actually work, is that the lower classes, particularly the marginalized sections, the lower caste, and the women actually face a lot more problems in terms of accessing the health services. So, in order to actually move out of their own social context and ascertain themselves and be able to access the services is something that's a huge kind of a hurdle. And the way the money lenders operate, for instance, in terms of lending money at a very high interest rate, it is again, in terms of certain social factors, because the way the lower classes actually require large kind of help, this is again provided only by the money lenders for certain social groups compared to other social groups. So the banks and other institutions are not accessible, and that becomes a very important kind of a thing for other groups to access. Similarly, the political factors, okay, it's largely the power that actually restructures the social relations. Okay, so what Debabar Banerjee and other kind of social scientists argued that the inequalities in the society are largely conditioned by the political kind of decision making processes. Why is it that doctors actually and a large part of institutional resources are available to elite and upper classes, while the lower classes actually are devoid of a lot of the support mechanism? It is again to do with the political organization of the society. In fact, Mark Nichter in his study in Karnataka clearly indicates that nurse actually becomes a mem sab who does not want to actually visit the lower class and lower caste households and lower padas, primarily because it is something that it is touching the lower class and caste people actually is impure, and also they do not actually get much benefits from these lower classes. So it is actually the conditioning of these things are all politically restructured. So this is the dimension that Sheila Zubrig actually brings out brilliantly through narration of this agricultural laboring woman called Raku. And in this book, actually, she narrates all these determinants, the social, the economic, and the political kind of factors that impinge. Okay, and sociologists have been actually talking about it's important to understand the society. Why are sociologists interested in actually explaining or understanding sickness? This is primarily because it helps you to understand the social organization. It understands how resources are actually managed, distributed, utilized in each society. Okay, so the way medicine, health, and society is interlinked is in terms of actually the larger social, political, and economic forces. So, what are the reasons underlying ill health? Okay, in this case, is it that Raku was not able to actually take her child to the hospital on time? Is that the reason why the child died? Is it because she actually has approached the traditional healers, the medicine men in the village, or in terms of accessing the local medicine? Is the traditional kind of a healing system which is actually an obstacle? Why do the primary healthcare centers in the villages actually close down by 12 noon? Why is it that a lot of these doctors actually do not stay in the hospitals for the whole day and provide services as mandated by the government? Okay, a lot of these questions actually require a deeper analysis. It's not about some doctors not staying in the primary health centers, not discharging their duties, or these agricultural women actually not able to reach. I think these are all interlinked factors. Okay, when you look at the way if you look at the medical professionals and their reasons why they are not able to discharge their responsibilities, it probably is to do with the kind of reward structure that they have compared to their own colleagues in the urban centers. It is to do with lack of motivation and the resources that they ask from the state. It is also to do with the medical equipment that's required for them. It's also to do with their elite status. So there are a number of factors why doctors do not actually provide the mandated services. Similarly, why is it that Raku kind of women are not able to actually reach out to the government kind of healthcare services which is provided free of cost? It is to do with the patriarchy, the way women's status actually which is low, and the agricultural laboring population which is tied up in terms of their own kind of work, where they do not have enough resources for them to immediately travel long distances to take them to a district hospital. Lot of these factors are actually responsible. So it's not to blame one against the other, but there are lot of political and structural conditions that actually need to be altered. Okay, so what is happening in terms of last 6 decades? Because it's not simply now. If you look at the healthcare system right from the beginning, okay, starting from the early stages where the PHCs and CHCs and district hospitals were established, a lot of manpower was provided, Anganwadi workers, community health workers were provided, and later on, I think the shift to family planning program, there was a huge kind of resource diversion, and in terms of health services actually targets were all towards family planning. So during emergency, the way family planning actually became very significant kind of a healthcare program, and later on with lot of resistance that the forcible sterilization actually stopped. While it may be a temporary phenomena, that it was not actually enforced, in that manner. But even today, you have, indirectly a lot of enforcement that is happening in terms of taking these women to the sterilization centers, because the health workers actually are given some incentives, the people who undergo operations are given some incentive. These are all temporary and ad hoc mechanisms through which, the healthcare programs are designed. What is required in a country like India is that, strengthening of the healthcare system at all levels, including the referral system, interlinking of these primary health center to that of district and state hospitals, and providing resources. Apart from it, the possibility of actually providing, better housing, the safe drinking water, and also the employment opportunities for the people. Unless the structural conditions of people actually are transformed, the possibility of these people actually gaining access to healthcare services is not possible. So medical actually services and medical profession can effectively operate in a social and political environment which can actually provide, this kind of a link in terms of improving their social and economic resources as well. So this is where I think sociology of health actually talks about how significant it is to understand the, the entire social conditions in a comprehensive manner. In fact, Michael Foucault actually says that, you know, the growth of hospitals indicates the sickness of the society. If there is more and more of hospitals and, the tertiary care services which are available in urban centers, which is indicated as the health kind of progress, it's not. You know, it is only indicates that certain kind of commercial interests and vested interests were able to actually, invest and, harvest based on the misery of the people. So the equitable kind of a distribution of resources is important, and the inequality that is actually playing an important role between different classes of people need to be addressed. And those societies which have less and lesser inequalities among different classes of people actually are the ones which are healthy kind of societies. So there is a direct correlation between health status and that of inequality. And this is where I think I wanted to look at, how social, economic, and political forces play a very important role. And I'm sure, I think you will be able to gain a lot more if you read this Raku story, which is very interesting, which is written in a very lucid manner. Sheila Zubrig actually was an activist who observed and actually written, a narrative of the poor people in Tamil Nadu. I think you need, all of you need to read this book and then, connect it with the module that is actually provided here. Please also see the further readings that are given at the end of this module. Thank you.